Hello, everyone. It is my pleasure to welcome you all to the Emergency Medical Services for Children All-Grantee meeting, Adapting and Forging New Paths. This is our first virtual meeting and hopefully our last. At each meeting, we celebrate and share our successes, but this meeting is truly remarkable. You have all been steadfast and taking care of the emergency medical needs of our nation's children and their families for the past year and a half. And you have been doing this work with little coworkers at home, or teenagers, or college students, or adults and their friends. You have been trying to care for and protect your family members. And many of you are grieving those you have lost. For some of you, in addition to the pandemic, you have managed other crises, wildfires, floods, caring for refugees, and of course, hurricanes. We at HRSA are so appreciative of your remarkable commitment to the EMSC program during this time. For the next 3 days, we hope this all-grantee meeting will allow you time to celebrate your collective successes and lessons learned. We also hope this meeting gives each of you the time to reflect on why we do what we do and remember why we love what we do. Please celebrate your work, your passion, your resilience and adaptability, and your amazing ability to forge new paths ahead. I look forward to sharing these next 3 days with you. Now, I would like to start our all-grantee meeting with opening remarks from Dr. Michael Warren, the Associate Administrator of the Maternal and Child Health Bureau in the Health Resources and Service Administration and the U.S. Department of Health and Human Services. Dr. Warren?
Thank you so much, Dr. Kinsman. Good morning, everyone. It is so good to be able to be with you at the start of this all-grantee meeting. As Dr. Kinsman mentioned, we would much prefer to be in person. That's not where we find ourselves at the moment. And so we will gather again, and we look forward to that day. In spite of that, we are grateful to be able to connect with you in this way. Before I get started on my slides, I also want to echo Dr. Kinsman's thanks for the tremendous work that you've done over the past year and a half. I think many of us had hoped we would be in a different place right now. This cycle with the Delta variant and the increase in utilization of a variety of health resources that we're seeing at the moment is certainly taxing a system that was already overtaxed through the first parts of the pandemic. And add on top of that, the various severe weather events that Dr. Kinsman mentioned. We so appreciate the work that you all are doing on the front lines every day to keep kids and their families safe and to connect them to care. Thank you. We appreciate the way you're not only taking care of them, but you're taking care of each other. And we're grateful that you're spending some time today with us. With that, I will launch into a few slides, if we can have those on the screen. And I'm not seeing them, so if someone will let me know when they're showing.
And are you seeing the slide?
I'm not seeing them, but that may be something on my end.
No, we're not seeing them yet either.
Okay, thank you for that. I promise the slides are prettier than my face. You don't want to see my face on the big screen for the next few minutes.
In fact, they're in the participants box. We can see them, but we can't see them on the main screen.
The text says don't watch the web page. They're up.
Okay, well then I'm going to try to do this by looking in my little screen at the top in advance and hope that we will be okay. Someone let me know if I'm grossly off track, please. I'm a pediatrician, so I'm nothing if not adaptable.
Participants, if you double click on the screen that shows the slides, they should come up as your main screen.
Thank you. So our mission at the Maternal and Child Health Bureau is to, sorry, I'm navigating these screens and having difficulty with that. There we go. Our mission is to improve the health and well-being of America's mothers, children, and families. And our vision is an America where all mothers, children, and families are thriving and reach their full potential. EMSC plays such an important role in helping us to accomplish that mission. And over the past year, we have finalized our strategic plan. Many of you were involved in providing input to the development of that strategic plan, helping us to identify what strategic goals we should focus on for the next 10 to 15 years. And we deliberately took a 10 to 15 year lens to this work because it takes a while to change things in government programs, particularly federal government programs. I've worked at both the state and federal level, and things just move more slowly sometimes than we would like for them to move. And the reality is we're a grant-making organization. Most of our grants, as you all know, are given out in 5-year increments. And so if we came up with a 3 to 5 year strategic plan, we wouldn't really have an opportunity to make a lot of changes because we've already spoken for what we're going to fund for the next 3 to 5 years. So it was important for us to take a broader look and to look 10 to 15 years out into the future. The other aspect of this is to borrow from a quote that I love from hockey great Wayne Gretzky. Someone once asked Wayne Gretzky how he got to be so good at hockey. And his answer was, I skate to where the puck is going to be, not to where it has been. And so we tried to take that tack when thinking about the strategic plan. Where is the puck going to be for MCH populations in 10 to 15 years? And what do we need to do to skate toward that? How can we change what we're doing today to be ready to meet the needs of the population in the future? And so we landed on 4 key goal areas. You'll see those in bold print there: access, equity, public health capacity and workforce, and impact. And so all of our work in the next 10 to 15 years will be oriented around those 4 key goals. Now, if we think about the EMSC program and how it fits into that, we go back to the authorizing legislation. We've got a lot of programs in the Bureau. It can be difficult to keep track of sometimes. And so I like to go back to the primary source. What did the Congress authorize us to do? So for EMSC, they authorize us to make grants to states or accredited schools of medicine to support a program of demonstration projects to expand and improve emergency medical services for children who need treatment for trauma or critical care. And so those key activities, expansion and improvement, really are the thrust of all of our efforts within EMSC. And if I think about our strategic plan, that aligns very well, particularly with a couple of our key goals. This notion of expanding and improving care aligns with this goal of access. And as we think about achieving health equity, this notion of for children who need care, the legislation didn't say for some children who need care or for children in these states or for children of these races and ethnicities. It's for children. That's for all children. And so this really ties in with our focus and our strategic goal around advancing health equity for MCH populations. So we think and believe very strongly that EMSC is very aligned with our work and our strategic plan moving forward, and that you all are an important part of that work as we move into the next 10 to 15 years. We do this work in EMSC through a variety of grant programs and projects. You all will see yourselves represented in this honeycomb here through a variety of the projects that we have in our portfolio, whether we're talking about our state partnership grants, our targeted issues program, the PCARN Research Network, our Innovation and Improvement Center, EIIC, or our data center. All of these
recording in progress
along with the strategic partnerships that we enjoy through the EMSC program really make this program work. And again, help keep us focused on those goals of expanding and improving emergency medical services for children. Those partnerships are so key. And on the screen, you'll see just a snapshot of some of the other federal agency partners and national partners that we work with. None of us does this work alone. You all know that in your day-to-day work, if you're in a pre-hospital agency, if you're in a hospital, if you work for state government, if you work for an academic center, none of us is really able to achieve the kinds of population level outcomes that we would like on our own. These partnerships are absolutely key. And for many years, several decades now, EMSC has enjoyed a rich partnership with all of these entities that are listed on the screen and more. So we want to acknowledge that work and thank them for their continued partnership and engagement. Since we are here and we've got an opportunity to celebrate, we wanted to take an opportunity to highlight some recent accomplishments that have been made possible through the EMSC various programs that we fund. One of the things that's been an area of focus is increasing interfacility transfer guidelines. So we know that where kids initially present may not be the ultimate place where they end up or receive definitive care. And so we've seen an increase in those transfer guidelines, which help kids get to the right place. We've seen an increase over the last 5 years from 50% to 58%, and that's as of 2018. So we would expect that those are even higher now. We've seen an increase in the number of states that have pediatric medical recognition programs from 5 back in 2006 to 17 in 2020. So a great way to recognize programs within your state, hospitals within your state that are providing high quality care and that are ready to meet the unique needs of children. And we've also seen an increase in the percentage of EMS agencies with a pediatric emergency care coordinator. That increased from 30% in 2019 to 36% just 1 year later. Having those PECs is so important to be able to think about the unique skill set and knowledge base that folks need to provide care to pediatric populations. And we appreciate the work that has happened to increase the percentage of EMS agencies that have those PECs. We've also seen, particularly across our research networks, an advancement of the evidence base around a variety of important issues that are common in emergency department settings for children. So not only thinking about what is the impact of pediatric readiness, so sort of globally the work that we're doing, but specifically how do we manage things like DKA and how do we avoid pediatric dosing errors? We've seen the incorporation of behavioral health resources into emergency care using our Critical Crossroads Toolkit. This was a partnership between many of you and our Federal Office of Rural Health Policy here at HRSA and the Maternal and Child Health Bureau. Certainly timely given the feedback that we hear from so many of you about an increase in presentation of behavioral health diagnoses in emergency departments. And then from a sustainability standpoint, we've seen in many states an integration of EMSC priorities into statutes and regulations. So one of the things that we all know is that in order for some of these changes to be long lasting, we need to hardwire them. And one of the ways that we do that is through statute and regulation. And so many states have been able to advance this work through that way as well. Also want to take a moment to highlight the participation in the PEDS Ready, the Pediatric Readiness Project. So that is open, I believe, through today. There has been strong participation across the country. It is variable, so you can see with the map, the different shades and the colors of the states represent the proportion of hospitals that have responded in those states. And this slide was captured mid-August when we had to get these slides through clearance. So I hope that number is even higher today. One of the things that I think is important to recognize is that many folks across the country have worked so hard to engage partners within their states to complete these the questions on this survey. In some of the states, for example, that we look at, you're talking about several hundred hospitals that have been engaged. And so just want to give a shout out to all those who have been involved, whether you're working at the state level to help coordinate the ask and to get folks to respond, if you're at the hospital level and actually doing those responses and inputting those. Thank you. These data are so important to us. It had been 8 years prior to now before or since we had a national pediatric readiness estimate. And we want to work with our EMSC partners moving forward to think about how we can do this in a more timely way. Probably not something that we can do every year, at least on a national level. But if I think about when I was in clinical practice, I wouldn't make patient care decisions on data that were 8 years old, probably not even 8 days old in most cases. And as a clinician for the population, a public health physician, making decisions based on data that are 8 years old is challenging. And we know that the collection of these data are challenging. And so we want to continue to work with all of you to think about finding that sweet spot where we can make the data collection less burdensome and also have more timely data to be able to tell the EMSC story. I am super excited today to also be able to share with you that the President's budget for fiscal year 22 proposed a $5.8 million increase for the EMSC program. And this is notable because this is the first time in a President's budget where we've seen an increase for EMSC in over 20 years. And I think that speaks to this commitment to advancing the care for children across the country. We at HRSA, if this budget passes in this form, we're committed to supporting additional funding to states to address critical gaps that we know remain in our EMSC work, and also to help build this capacity for supporting mental and behavioral health presentations in emergency departments. As you all know, the President's budget is the first step of a long process that involves deliberation by the Congress. The fiscal year that we're currently in, fiscal year 21, will end on September 30th. And so if we have a new budget for fiscal year 22, it will start on October 1st. If we don't, we'll be operating under a continuing resolution, but we will certainly keep you all posted as this advances. And we are hopeful that this increase will remain in the final budget that is passed, and we'll be able to pass along those supports to our state partners. Earlier, I mentioned the impact of COVID-19 on EMSC, and I want to take another minute or so to dive into a few of the key things we've heard from you all about the ways that COVID-19 has been impacting you. In the very recent past, seeing again this increased surge, particularly around what I've heard described as the trifecta, so RSV, COVID-19, and behavioral health presentations, hearing that from a number of our colleagues in emergency departments, hospitals, children's hospitals across the country. That is all coming, this sort of new surge, coming at a time when folks were already experiencing staff shortages, loss of staff, either staff who had left the workforce to pursue other opportunities, or staff who had fallen victim to COVID, and also extreme fatigue and burnout from staff who have really been responding to this for a year and a half now. There have been times where folks have not had the equipment that they've needed, things like insufficient PPE, and you all as a program have had to delay or change a number of your activities because you have really focused on providing care for children and their families. And so again, just wanted to take the time to acknowledge the tremendous work that you all have done, the tenacity that you've shown, and the ways that you have taken care of each other. We want to thank you for that, and we commit to partnering with you, continuing to partner with you moving forward to think about how we best support you and the work that you do. One ask that I'd like to make is that as we move through the next few weeks and months, that you use your trusted voice. We know that all of you are trusted voices in your communities, and vaccination of people at this point 12 years of age and older is our key strategy for getting back to normal. That really is an area of great opportunity for us. We know at this point we've got COVID-19 vaccines that have been authorized for ages 12 and above. In the United States, those vaccines are safe, they are effective. If we look at pediatric populations, as of mid-August, just under a third of 12 to 15-year-olds have been fully vaccinated. A little more than that, 42% of 16 to 17-year-olds have been fully vaccinated. Just this week, we have learned that 50% of 12 to 17-year-olds have at least one dose of COVID-19 vaccine, which is encouraging, but that means 50% don't yet have one dose. And so there is great opportunity as we think about kids getting back to school. Being in person in the classroom again is so important, and it's going to be important for all of those who are 12 and older to be vaccinated. As we think back to one of our key goals around health equity, It's important to always think with an equity lens about whatever we're talking about. We know in the case of COVID-19, populations of color have been more severely impacted from a morbidity and a mortality standpoint. If we look at vaccination rates and look at this across all age groups, the lowest vaccination rates are among non-Hispanic Black populations. So we have a tremendous opportunity to think about how we achieve equity in vaccination. That's much easier said than done when you think about the history of historical injustices in this country and the mistreatment of populations and mistrust that is there. We've got a lot of opportunity for work. But that's why we want to partner with you and use your trusted voice. People, frankly, don't want to hear from me. They don't want to hear from the federal government. They want to hear from people that they know who are in their communities, who look like them, who sound like them, who they see out in the community, who they've trusted for years. That's who they want to hear on this topic. And so we appreciate you sharing these important messages. So I want to close by just thanking you for what you do every day. You know, at the national level, we frequently look at data that's rolled up across the entire country. So we're looking for national improvement across our programs. And if you think about a complex machine and the gears in a machine, we're ultimately trying to turn this big wheel here of national improvement. But that doesn't happen if all of you don't show up to work every day and do the work that you do. So the work that's happening in local EMS agencies and hospitals starts to turn this wheel. Community by community. And as that's happening across the country, we start to see state and regional change. And as that happens in more and more states and more regions across the country, we see that change in the national number. We see national level improvement. But the important thing to note is none of that happens without the work that you do every day. It can be really difficult on a day-to-day basis because of all the frustrations that happen over the course of a day and think, am I really making a difference? But please know that you are. I encourage you to use these few days together to celebrate the work that's being done across EMSC, to recognize the contributions that each and every one of you makes to turning this big national wheel of improvement and expanding and improving emergency medical services for children. And with that, I will close. Thank you so much for the opportunity to spend some time with you and look forward to any questions if there are any.
I see one question, Dr. Warren, and Hannah Watch is going to help us with this, but Hannah, I see one question, and that question is, will the annual funding per state increase if the president's budget goes forward?
Thank you. And thank you, Rachel, for that question. So in the budget documents, the language that I shared on the slides, it talked about increasing support to states. We will wait to see what the final budget looks like. So often what is included in a budget proposal may not match exactly what gets passed by the Congress. And so ultimately we will have to wait and see what is passed. We certainly recognize there is great need for support for states. Some of you may know before coming to HRSA 3 years ago, I worked in state public health for about a decade in Tennessee and saw firsthand the opportunity for impact that EMSC has at the state level, but also the real limitation in the very small amount of funding that states get from HRSA for EMSC and the opportunities that may exist if there was more funding. So please stay tuned. As we get more guidance in the official budget, we will be able to provide a more definitive answer. But right now in the president's budget, it does talk about increasing support to states.
Dr. Warren, I see another question, which is, does your thinking about protecting children in emergency services change at all with the Delta variant expanding across the US?
Can you repeat that, Dr. Kinsman?
Or does your thinking about how to protect children and provide EMS services to them change at all, knowing now that we are dealing with the Delta variant across the United States, which is more contagious?
Yeah. Thank you. You know, a couple of things come to mind. One, I say pretty regularly to folks, we have the tools and we know how to use the tools to prevent COVID-19. And so as we think about vaccinating populations that are eligible, if we think about masking, if we think about distancing, all of those strategies that have been shown to work remain true. I think the thing that is worrying me at the moment are the collateral impacts of this. And so as the resources are more stretched, what does that mean for everything else that is still going on? So kids with asthma haven't stopped having asthma. Kids with diabetes haven't stopped having diabetes. Unfortunately, injuries haven't stopped happening. And when the system is stretched to the extreme that it is stretched now, that is a challenge to be able to get kids to care, quickly, and for providers to be able to do all the things that they need to do. That is not at all because people aren't working hard, and hard is not even the right word. I don't have an adequate adjective to describe the way that you all and your colleagues are working now. And at the end of the day, there are just finite limitations in the number of hours and the number of people that are available to do this work. And so I think when I think about how COVID is changing care on kids, that is something that's coming to mind, particularly right now with the Delta variant. I hope that answers the question.
I think that does, and I see no other questions in the chat. Are there any other questions that folks have seen? Dr. Warren, I really want to thank you for joining us today. It is so important for the EMSC community to know we have your support and that you're with us and you're advocating so hard. And so just want to thank you so much for being here and starting us off today.
Thank you so much, Dr. Kinsman. It has been a joy to be connected with EMSC back from the days since I was a pediatric fellow, and in my children's hospital, they were a comprehensive regional pediatric center, and going out and doing some continuing education for EMS agencies, and then working at the state, and then being here at HRSA. I've had the opportunity, particularly over the last year, to meet a number of your national leaders in EMSC, and I have to say, I was always impressed with EMSC. I am even more so. The incredible talent that you all have assembled across the country is just remarkable, and it gives me great comfort thinking about you all being the thought leaders in moving emergency medical services for children forward. So thank you, and I hope you have a great few days together.
Thank you, Dr. Warren. Appreciate that.